Kōri I pō, kōri I ao. Ei tūria ki te whakaau nōtu. Nōtu te I, nōtu te wei, nōtu te wana. Tu iki tia, tu a painga. Tu whakaputi ki te whai ao, ki te ao mārama. Ti he mauri ora. I te timatanga, nā Māui, tēnei whenua o Aotearoa I hiika I te moana. I tana okinga ki te kāinga, ngā mautere, I te moana no I Ākiwa. E rere aere te kōrero ki aua mautere ana, e rere atu, ngā waka ki Aotearoa nei. Ko rātau mā, ngā tūpuna, ngā kākano o ngai tāuatiwi Māori. E whai ake rātau, I ngā kaipoke mai ingarangi, mai aua whenua o tā wā I ana, ko rātau ngā kākano o tātou katoa, te iwi o Aotearoa. Nō reira me ki a koutou, nau mai, ara mai, ki tēnei uinga o te kupu taurangi auora o Aotearoa. Kia ora mai. Mauria mai o koutou mate. Na koutou I tangi, na koutou I mihi. Pēra ia mātou o te au kāinga nei. Me ki ngā mate. Aere ki te taa o tāku te rangi nui woka. O maau, waru. Aere ki tua o te ārai. Ki te uinga o te kaurangi, ki reira oki ai. Kia tātou, te iwi e tautoko ana tēnei uinga nei, a tēnā rā koutou e mihi kauana I rongi o koutou tūpuna tino whakaira. Nau mai. Ki te rangatira, no ingarangi, no tuārangi, te waiwai tapu, Dr Marsh, ngā mihi ki a koe, I tēnei wā, e tino ari ko te ngākau, ko tae mai koe I wainga I a tātou. Ki a koe, Alan, me te rōpū o te komi ana nei, ngā mihi kauane ki a koutou. Kia kaa I tēnei rangi mo tēnei kaupapa e kawe nei, nō reira kia ora mai. On behalf of the Mana Whenua of Wellington, I'd like to welcome you all here. When I first started speaking, I mentioned the creation story myth, if you like, of Māori, of how Maui fished the North Island, the New Zealand, let's say, out of the sea. The truth of that story really boils down to the fact that it's a poetic way of saying he discovered New Zealand. And over time, when that story spread, that there was a wonderful haven down in the South Pacific, a number of waka ventured here. They were followed in turn by ships from first England and then all over the world, and they became the first Kiwis, I suppose you could say. And those that followed them, of course, came on planes, as Dr Marsh did today, and we're very, very happy to have you here. And I've got to say, it must be incredible having the skill and knowledge that you have, and also to be able to think, perhaps, not say, when someone says, well, let's face it, you aren't exactly a brain surgeon, to be able to think, well, but we are very, very fortunate to have you here. So welcome, thrice welcome, nau mai, ara mai, piki mai, kake mai, whakatau mai. Tēnā koutou, kia ora mai tātou katoa. Ha te whakapono me te rangi Māori e tātou e te aroa te whakapono me tātou, tātou e. Nō reire, ei wakakapi me ki āpiti hono tātai hono, rātou, te hunga wairua kia rātou, āpiti hono tātai hono, tātou kia tātou. Tēnā koutou, kia ora mai tātou katoa, kia ora.
Ena mana, ena reo, ena manu kōrero o te marae. He honore, he kororea, kina atua. He monga ronga, ki te whenua. He arawa, kina tangata katoa. Ti hei moriora. Ko te whare, o te hono ki Hawaiki e to ihone, tēnā koe. Ko te papa I takatone, tēnā koe. Te mana whenua o tēnei rohe, ko Ngāti Toa Rangatira, tēnā koutou. Te hunga mata ki te hunga mata, haere, haere, haere atu rā. Te hunga ora, kia tātou te hunga ora. Tēnā koutou, tēnā koutou, tēnā koutou katoa. Nā mai, haere mai, ki te tātou manahiri tuarangi. Tēnā koe o te rangatira, Mr. Marsh. Nā mai piki mai ki tēnei whenua, tēnā koutou, tēnā koutou, tēnā tātou katoa. Good morning and welcome to this really very important and exciting forum today. I would particularly like to acknowledge and welcome Dr. Henry Marsh, or Mr. Henry Marsh. Actually, in New Zealand, we more commonly call surgeons doctor. Actually, if you're me and you're in the medical school and one of your students wants to talk to you, it's quite likely that they'll just call you Alan. And more recently, they have more commonly been calling me Prof, and I thought that reflected a growing awareness of the importance of a bit of respect, but it finally occurred to me that this is just because I'm looking older and older. Now, everybody here will know that Henry Marsh has a long and distinguished career as a neurosurgeon. I would commend to you his book. It is a very, very readable account of the life of a neurosurgeon, but the thing that really emerges from it is a very real appreciation of patients as people. And I think that's a really core element of this whole issue of consumer engagement. It starts with the interaction between medical staff and health staff generally, medical, nursing, and everybody involved with hospitals, and patients, and the sense that your patients are people is at the heart of it. And that really is the overwhelming message that I personally got from this book, and I do commend it to you. I'd also like to welcome Martin Snedden. Everybody will, of course, know Martin Snedden, vastly experienced in both sporting and business fields, and he is going to talk to us about common factors of leadership across the sectors. I'm not sure if Chai has actually arrived, but I would like to welcome Chai Chua, Director General of Health, who is going to address us shortly. Later on in the morning, we will be hearing from the Minister of Health, the Honourable Dr. Jonathan Coleman, and we look forward to that. Just before lunch, we will hear from Libby Burgess and Frank Bristol about a consumer perspective on leadership and the challenges faced by consumer leaders in a complex health system. After lunch, we will have presentations from our own clinical leaders. Dr. Nick Chamberlain, CEO of Northland DHB, Leanne Takaru, Tarupi Maori member and clinical pharmacist, Professor Dawn Elder, Head of the Department of Pediatrics and Child Health at the University of Otago in Wellington, and Deputy Chair of the Commission's Family Violence Death Review Committee. Clinical leadership is an area that the Commission is increasingly concerned with and active in. It is the final topic of the Commission's Open for Better Care National Patient Safety Campaign. A clinician's leadership skills, ability and knowledge play a key role in improving quality and safety in healthcare. And leadership skills are not just about individuals, they are actually about teamwork and about bringing together teams and the coordination and working together that is at the heart of teamwork. Today's event is part of the Commission's Open Forum International Speaker Series. These one-day workshop conferences, which I think are pitched at a high standard and bring in international speakers supported by excellent local faculty, I think are working very, very well indeed. Previous ones have included Dr. Atul Gawande and Professor Jim Bajan, and I think today we'll build on an excellent tradition. The Open campaign next week will be holding the first of 7 regional forums for emerging clinical leaders. These are 4-hour workshops which cover the skills that will help leaders ensure their organizations offer the safest and highest quality of care. These workshops have actually been oversubscribed, with people from all aspects of the health service, including significant numbers of senior consultant doctors, but also nurses, CEOs, and the whole range of people. I think that's very exciting and is a great testimony to the importance placed on clinical leadership in the sector. This today is part of the Commission's work in developing capability generally, capability in leadership, in quality and safety. Along with consumer engagement and with measurement and evaluation, building capability and leadership underpin our work. I think today is going to be a really outstanding example of that effort. Thank you very much.